She's gonna ask, right?
Right. But if I open her mic
Yeah,
and her speakers,
open her mic as long as she doesn't talk.
yeah,
So you want, give me a mic check, would you? Could you give me a mic check? Sir. Oh, could you give me a mic check?
yes, but let me, here.
Oh, sorry.
Yeah, I'm just trying to.
Just a mic.
Laura, ¿me escuchas?
Está bien.
¿Está bien ahí?
Yeah.
No hay feedback? Tampoco de la, is there any feedback on her?
Oye, I can hear her, pero.
No, a mí, es que al final, a ver, yo solo creo que voy a usar el Zoom para poderle hacer la pregunta, porque no puedo grabar nada, you know?
Pues
So,
Cuando
I mean,
terminan, puedes preguntar.
sí, y como te digo, de la página del Facebook tenemos el video ahí, o del pool también, ¿no?
Máquete tú. Put yours on mute. That'll be good. Yeah.
Well, that one's gonna be on there.
Yes. Ella cuando terminan, puede preguntar.
Y'all ready? You guys ready? Give me a thumbs up.
Ready? Yes, everybody? Yes, sir.
Wonderful.
Thank you.
Good afternoon, everyone. I'm here to share some good news with you today for a change. So back in May, we rolled out the Dallas County COVID-19 health guidance for the public. And I'm going to let somebody have their phone back. Somebody's having a phone call on
Yeah,
this.
you need to mute that.
Yeah, here you go. Here's your phone. So back in May, we rolled out the Dallas County COVID-19 health guidance for the public and color-coded risk chart. The document and the metrics were created by our Public Health Committee, which is made up of public health, epidemiology, and infectious disease leaders who prepared their entire adult lives to advise us in this moment. Since May, we've been at red on that color chart, and today I'm proud to announce that last night the doctors unanimously agreed that we could move to orange on that chart. Red is extreme risk and orange is moderate risk. Now this achievement is due to what you as a community have done. Wearing your mask, 6-foot distance, washing your hands, avoiding unnecessary trips, and up until now, avoiding any many of you avoiding those indoor activities where a mask could not be worn 100% of the time. That's what is recommended by the doctors in red. I fully recognize that there are people out there who are not following the doctor's advice. But for many, many people, they want to know not what is legal, but what do the doctors say is safe. Under orange, there are other things that you can now do that the doctors say are safe that they would not have recommended while we were in red. Now let me start off by making it very clear that the things that we're about to talk about, the doctors are contemplating that these are still done with a mask on, with 6-foot distancing, washing our hands frequently, and doing all of those things that have proven to be effective in stopping the spread of COVID. So under orange, healthy people under the age of 65 can dine in at restaurants if the tables are spaced more than 6 feet apart and the staff and patrons are taking the appropriate precautions, which means the staff is masked and that people who are not eating are masked. Expanded shopping beyond essentials with a mask and proper distancing is something that the doctors say can now be considered. Small events with good practices in place, preferably with 10 people or less. And so, for instance, what would that look like? It doesn't mean you could have, under the doctor recommendations, you can have 10 people over to your house, not wearing your mask and all eating around a table together. It means you can have a few people over, preferably less than 10, with mask on. And for instance, if you're having that backyard barbecue with your family and your siblings' family, you would set 2 tables up so that when people take their mask off and they're eating or drinking, they're well apart from one another. Religious services in groups of less than 10 can be considered with good practices. So again, 6-foot distance and mask less than 10. Movies can be considered if the occupancy is at 25% or less in that theater. And that may be difficult to do because I think in Texas the governor has an occupancy level that's higher than that, but I don't know how many people are going to the movies. You may be able to find one that is not that full. Going to museums and libraries where the occupancy is 25% or less is now something the doctors are saying is allowable. One that Phil and I are extremely happy to hear about is haircuts and going to the barbershop or hair and nail salons. As long as those are at 25% and strict guidance is allowed. I've had some haircuts with my beard trimmer from my razor and a comb, but not from a barber, and Phil looks like the fifth Beatle over there, so we are looking forward to a haircut. All right, swimming pools with the use of lanes or plenty of space can be considered. Individual sports like golf and running are fine with safe distancing and no shared equipment. Small group non-contact sports like tennis are okay under orange. Bowling can be considered with strict physical distancing and masking. Our medical and public health experts have also advised that as we move to orange, our schools can now prioritize and open in person for our younger learners, such as pre-K through the 2nd grade. Our special education students and any other students at risk, such as students without access to the internet or remote devices, students who need to come in for a placement test of some type. If space allows, schools can welcome back students in grades 3 through 5 as well under the doctor recommendations. However, the doctors strongly discourage in-person learning at this time for grades 6 through 12 until we reach yellow or green. Now here's a few other, and the doctors have highlighted this because this is extremely important, a few other things that our residents need to know. Residents and businesses should continue to be disciplined and follow and encourage and enforce the 3 W's. Wear a mask, wash your hands, and watch your distance, or it's the 3 M's in Spanish. If you have been delaying medical care, now is a good time for you to talk to your provider, your doctor, about getting that medical care and work with your doctor to make those decisions. It's now a good time for you to get your flu shot. And so Dr. Wong's going to talk more about that when he comes up. Now for high-risk individuals, that's anybody over 65 or anybody with an underlying condition that does poorly with COVID, which includes diabetes and obesity, or high blood pressure, heart condition, lung conditions. These are folks who do poorly when they get COVID. If you're in that group, you need to continue exercising extreme caution. You're basically still in the red as we try to move down from orange into yellow by making good choices. But you're still in the place where you were if you're following the doctor's advice. Now we ask our residents to avoid high-risk activities still, and this again from the doctor groups. This would be large gatherings with people, with over 10 people, including family events. This would be any gyms, movie theaters, or indoor settings that are over 25% occupied, and any type of team sports, because there's just no way to do that without breathing all over each other. The committee's message is this is a marathon, and to stay in orange and eventually move to yellow, we all need, all of us, all of Dallas County, and really all of North Texas and our businesses, to continue to follow public health recommendations for masking, physical distancing, and hand hygiene, along with avoiding high-risk situations. Now, we're also entering a holiday weekend. We've had 2 events here in Dallas County that have shot up COVID: Easter Passover and Memorial Day. 10 days after each of those events, we saw a huge increase in COVID. In fact, it's taken us 3 months since Memorial Day to get back to where we were the week before Memorial Day on the average number of daily cases. We did a great job, and what I mean is you, not me, but you did a great job on July 4th in wearing your mask and not going out to big stranger celebrations and big group celebrations. We didn't see that spike on July 4th. We've got to have another holiday this weekend, like Labor Day has to be like July 4th was, not like Memorial Day. If we let our guard down this weekend and do things other than what's on this list, which also you can find at dallascountycovid.org. It'll be on there for your family to download it and look at it. If you go beyond that for this weekend, then we're going to see a big spike 10 days after that, and we might end up back in the red. So let's please keep those gatherings small, and keep that mask on and that distance for this weekend. It would take us until, say, Thanksgiving, if we screw this up for the weekend, to get back to a safe level. And we want to be going into Thanksgiving in an even better place than we are now. And I'll say this: if we can get schools right, if we don't mess up the way we open schools, and we don't mess up this weekend, I can see us moving down it's up to the doctors, but to meet their metrics that Phil will talk more about in a moment, we can get to yellow and we can get to green, and we may be able to get there this fall if we don't do, there's 3 ways we can derail this. We can have a change in masking and bar policy where that would spike up the COVIDs, and that's not up to us, that's up to the governor. But it's up to all of us. If we can do a good job this weekend and not expose ourselves to unnecessary risk on the holiday weekend, when 7.6 million North Texans are all celebrating a 3-day weekend, and if we can do the school opening stuff right, then we've got a really good shot to get get lower, get down to yellow, and get down to green this year. Now, while all this is good news, we are starting to see flare-ups in other parts of the country where they let their guard down, so we just cannot let that happen to us. There's a few more pieces on COVID that I want to make you aware of. We have seen a decrease in the number of people getting tested, but testing is available to every Dallas County resident and every resident of the city of Dallas, even if you live in one of the other counties, for free at our locations. If you're over 5, whether you have symptoms or not, you can now get a COVID test. So if you want a COVID test, please get one. That way you can know your status. Now, our testing sites are closed today due to inclement weather. There are 2 drive-through sites and 3 walk-up sites across the county, and those are normally open 7:30 a.m. to 4 p.m., and we encourage you to use those. Also on evictions, I think you saw this, there was some very good news on evictions yesterday. The CDC released an order halting evictions nationwide. We will quickly follow that here. It applies to individual renters who do not expect to earn more than $99,000 or a family at $198,000 for joint filers. There are certain things that you need to do. By the way, if you didn't report any income because you didn't make enough to file income tax or whatever, but you got a stimulus check, you're covered in that as well. But renters must indicate on a required declaration form that we'll make available on our website for you that they cannot afford to pay their rent in full, and that if evicted, they would become homeless or forced to move to some sort of congregate housing, like a shelter. Renters must also be able to prove that they made an effort to receive government assistance and they could not afford rent. And this will take effect on Friday through the end of the year, December 31 of 2020. Also yesterday, two other things that are worthy of note for you. The Commissioners Court approved their portion of the 10 new directions for public safety and community change. This is the culmination of work between community groups interested in policing reform, city managers, and the county administrator, Daryl Martin, who moderated and led those discussions. You're going to see investment from our cities and our county in the millions and millions of dollars in doing things that increase the budget of helping people who are normally right now interfacing with the police. So a lot of money going into helping departments create teams of mental health care professionals that answer calls for mental health distress as opposed to the police. Money going into finishing out centers for homeless youth to divert them from situations where they would have interactions with the police. And a lot of effort going into rewriting policies on a department by department level to modernize and have duties to intervene and modernize deadly force and other policies. Last couple of things. I believe the county will be able to move to the effective rate. So in other words, you will see your taxes go down this year at the county level, and Parkland likewise will cut taxes as they have the last couple of years. And so we'll have the lowest penny tax rate that we've had in 10 years. I don't know where the other jurisdictions will be, but this will help some. So I think that's some more good news. Lastly, I need your help on something. I need your help on two things. I need you to wear that mask and really have a responsible weekend. The other thing I need your help on is the census. We've worked really hard on the census, and actually Dallas County and North Texas are a little ahead of some other places on the census. Now we're all still behind where we were 10 years ago because COVID has kept a lot of door knocking and church and other events around the census. I need people to fill out the census, please. It doesn't matter whether you're a citizen or not a citizen. If you live here, we need your help. Employers, I need you to get your folks registered on the census. This is the last month. If we don't get it done this month, for every person we miss, we're out $15,000 in government monies for our schools for the next disaster response. We really, really need to know who's here numbers-wise, so we'll have the right number of hospital beds and chairs in the classroom for the kids and services for people for the next decade. Even a 1% undercount, that is missing 1% of the people, would cost us $40 million in assistance to our community. So we just cannot afford to do that. It's your tax dollars that you send to Washington. Let's make sure we get it back for you. Last thing, I want to thank everybody in Dallas County, particularly Dallas County Homeland Security and Emergency Management. They did a great job on helping the people with the hurricane relief. We've still got about 2,500 people from the coast here that we are helping, and also all of our volunteer organizations active in disasters that have stepped up to help those people as well. And so now I will turn it over to Dr. Phil Huang. Let me grab my mask. Sorry, buddy.
Thanks, Judge. Yes, the judge mentioned this is a big day for us that we've been waiting for a long time, and our Public Health Committee has been really, reviewing all the metrics. We've been showing them at all of these press events. We're providing more details, and enhancing them, and have some more of that information. But these are some of the metrics that we've been looking at since the start of this, and I'll go through some of these. These are the suspected COVID-19 ER visits in the last 24 hours, and these first metrics are the things that are really measuring our infection rate in our community. And you can see we've seen a significant decline, steady decline since mid-July. Next is the confirmed admissions to the hospitals. Again, steady decline since late July, trails a little that visits to the ER, but decline. What the cautionary tone in all of this is that, it's flattening out. It's and so we're in a precarious position, and as the judge mentioned, it's really very important that as we move from red to orange, it doesn't mean we can open up and just do everything, go back to normal. We have to keep doing all the things that got us here, that made us to be successful. We need to keep doing all the universal masking and 6-foot physical distancing and washing your hands and staying home if you can, and teleworking, because these are starting to flatten out, and we don't want it to go back up. Next one, slide. This is the confirmed inpatients that are hospitalized, both for general hospital beds and the ICU beds. Again, this one now, it's delayed from when it started dropping, but August, early August 6th, and it's declined, but that's starting to slow down in that slope also. So next one is deaths, and we said, as we pointed out, that's the sort of the trailing indicator on all of these. And again, this was since end of July, seeing that decline, but that's starting to flatten out. So it's really, next, and then this is, we have been looking at the cumulative positivity rates. These numbers, and some of the numbers, they're difficult to get reliable data on this. You've seen some of the problems coming from the state level in terms of getting these positivity rates and the way we're calculating. We've established a steady way of doing that. We did not meet all of the indicators that we've been looking at. But what we've been looking at is like if we were meeting the indicators for 75% in each of the various categories, that was enough for us to move from red to orange. But again, I just want to really emphasize again what the judge was saying. This is precarious, and it truly requires everyone remaining vigilant with all of this, because we did not meet the percent positivity indicator specifically. We monitor this from various ways, and we look at the data from various ways. We've also looked at the hospital-specific numbers. Those are a little closer to the 10% mark that we're looking at, but I will say we did not meet this one community-wide based on the way we're calculating this. And my last slide. So as I mentioned, those metrics that I just showed are in the general category of the infection rate metrics, and these are the ones that we've been monitoring since the start. We've said from the start that we don't just look at the number of new cases that we're reporting each day, because sometimes that is dependent on the testing. We've seen lately how that's also dependent on the delays of getting those reports from the state health department. As a matter of fact, today we're reporting 358 new confirmed cases, but then that's sorted out. 207 of them are from the electronic lab report system from the state, but then most of those are from August. So we sort those out. So we just emphasize we've been looking at various data sources. Some of the other indicators, we've been looking at some of the diagnostic testing and surveillance and assessing, how accessible for symptomatic, asymptomatic, high-risk individuals and contacts to access training. And, are tests ready available for essential personnel? Are there adequate supplies of some of these testing supplies? And those are some of the things that we've been assessing also. And we feel like, based on, the reports that we're getting from the DFW Hospital Council and others, that we're able to move from red to orange on that. The case and contact investigations, those are some metrics we're still developing. Healthcare readiness, things like the percent of the occupancy of the inpatient beds in the hospitals and the percent occupancy in the ICU beds. We have met that, being less than 20% of the med-surg beds being COVID-19 and less than 30% of the ICU beds being COVID-19. Sufficient PPE for the healthcare facilities. And so these are some of the other indicators, and then protecting at-risk populations. Some of the assessment of whether long-term care, congregate facilities, other essential workplace settings, having sufficient personnel and PPE, things like that are some of what we've been looking at. And that's why, again, we've looked at the numbers in its entirety. Not every indicator did we meet the metric that we were wanting to meet, but we met at least 75% in the categories, and we feel that it is okay to move from red to orange. But I think just a good way to think about it, we talked about, and the judge mentioned this, right before July 4th, we said we cannot have a weekend like we had Memorial Day weekend over July 4th. Similarly, with Labor Day coming up, we cannot have a weekend like Memorial Day over Labor Day. And people really need to remain vigilant with all of these, with the universal masking and physical distancing and all of this. This does not at all mean that we can let up. I just want to, the judge went through the various things that, now that's different from being orange to versus red. Just a couple things. Flu shots. We are now, starting to enter and get into flu season. We have flu shots available. They're now available more out in the commercial areas. CDC's recommendations, get it in your shot in September or October. Anyone over 6 months of age. But it's more important than ever for people to get their flu shots this year, for multiple reasons. But for one thing, we don't want to have a bad flu season and then also have perhaps COVID-19 going on simultaneously. There's some, overlap in the symptoms, so confusion in terms of diagnosis and what the situation is going on. So, it's the flu shot, getting a flu shot is something we've got a vaccine for. It's just an easy step for everyone now to do to protect themselves on that. Finally, two things just want to make sure you're aware. Our emergency housing assistance program that for persons who have been adversely impacted by COVID economically that need rental assistance, mortgage assistance, or assistance with their energy bills. For those persons who live outside the city of Dallas, we have our program that's available. It's a rolling application, then there's a rolling lottery system that complements, I think the city has a similar program. The other thing that just want to make sure that we just got in place last week was that for persons that need like to be isolated or quarantined if they test positive for COVID, but their home situation, they may have someone who's high risk, like on chemotherapy, and their house is so small they can't sort of be in separate areas with separate bathrooms or things, or similar situation. We have for non-complex populations, meaning these are not for homeless persons or persons with substance abuse or mental health problems, but just non-complex, but that need that housing because of perhaps, again, some of the examples I gave after they've been diagnosed with COVID-19, that we have a new program that's available for that. The referral has to come through a healthcare professional, but you can find out more about that on our website also. So.
Oh, yes. My primary question is helping the public understand the distinction of the risk level. If you're telling me the category showing you're going in the right direction, but you're opening the window of opportunity for them to do more things, it sounds like you're giving them two different messages. So I need clarity on what am I allowed to do now because you're going in the right direction, and does that pose a problem going in that direction?
You know, again, that was a consideration that we certainly looked at. You know, we wanted to be true to the metrics and to what we'd been saying with our risk categories from the start, that we're going to be evaluating this when we saw those 14 days of decline. And, you know, we had to, the question was, you know, these mixed messages in terms of we're saying we can move from red to orange, but then at the same time, these cautions about, you know, opening up and going to these things. And so, again, our committee really was looking very carefully at this. We wanted to be true to what we've been saying from the start, that we're evaluating these. We're looking for these 14-day reductions on some of these indicators. We also then, to caveat that, had to look at maybe putting in a 7-day lag, because there's some of the reports that we get in that for the immediate prior 7 days, it takes a while to get accurate results. So we were looking at that with that in mind. Also, some of these indicators looking at 7-day lag, but seeing that 14 days worth of decline, and so we saw it. And I showed you those, you know, charts. And we don't, you know, we want to acknowledge that, because it is a testament to everyone's sacrifice and what they've been doing since, you know, right before July 4th. The universal masking. I think our community's done great with that, and, you know, trying to do more physical distancing. And so, but people need to keep it up. We were very conscious that this is also in the time when schools are talking about opening up and colleges are, you know, coming back, that it's very precarious of what is going to be that impact. And we will be monitoring these. And if it starts to go back up and it indicates that we need to go back to red, we will do that. But we want to give people, because, again, to be true to the metrics and what we've been saying from the start, we saw these declines. We are acknowledging that we've done what we need to do. We can justify that, but it is going to take, it's all going to take everyone being vigilant on these.
Is masking the number one metric you're seeing to ascertain the reduction? Is it masking? Is there any way to really determine that?
You know, the question was, is masking the major determinant of this? Certainly, when we look at, you know, the timing of some of the different changes that have occurred, again, you can see time trends. You can see when these start dropping, and they trail each one. You know, again, hospital admissions trail the hospital ER visits, and the deaths, you know. And so when you look at the timing of these things, certainly the universal masking, closing of the bars, timing-wise, was very linked to this, and it makes sense with everything we've been saying. We've said how important some of the asymptomatic spread is, that with the universal masking, that prevents even people who don't have symptoms to prevent them from spreading it, because that's what's really dangerous. People don't even know that they have it, that they're infected, and they can be spreading it further. And that's why it's so important for everyone to be using the mask and wearing it all the time when they're around other people. Oop.
People have been getting haircuts, people have been going and eating in restaurants, people have been going to the gym. Why does this guide still matter? Why are you still using this when people have already been ignoring it?
Question was, people are going to the gym, people are already eating out. Why do the guidelines matter? From the start, we have said that just because you can doesn't mean you should. There were things that were being opened up at the state level, and they were open, but there were a lot of people that we were hearing from that still wanted the guidance. What is the recommendation of our local experts based on actually what's going on at our local level? What are our recommendations? And that's what this continues to be. And it's because, so I mean, I think that there are a lot of people who do still follow the guidance. Things are opened up and you can do a lot of things, but there are people who are looking for what's recommended. And so that's where this fits a role. We're putting it out there in that same manner, and you know, that's sort of the situation we're dealt with.
And I hear that. I guess the thing is, like, if I'm skeptical of the numbers, and I'm skeptical of the guidance, and, you know, I'm just thinking of the person who just thinks this is nanny state run amok. I have seen Dallas County already open, and now you're just now telling me I can go get a haircut, but I've been getting a haircut for weeks? I mean, how does that, what do you say to those skeptics that you actually want to have them follow this advice?
So again, the question regarding skeptics who said, hey, I've already been getting my haircut, I've been doing these things, now that we're moving to guidance, what do we tell them? Again, I think that not everyone, follows these. Fortunately, I think we're seeing, like with the universal masking, anecdotally, I go to the store, I know there are a whole lot more people, and a high percentage, almost everyone, is in there wearing a mask. We still need to work on wearing them properly. You got to cover your nose. You can't just put the mask underneath your nose. It should cover your whole face. But, a whole lot more masking that's going on. People, it's making a difference. We're seeing the impact. Not everyone has probably been, I'm sure, following the guidance, but there are a lot of people, we hear from a lot of people that they are looking for those recommendations and are following it. Again, you don't get everyone, but if you get a significant percentage of the population who are doing these, and that's what it's going to take. I mean, so we don't go back up to red, so that those numbers, and those are the ones, the hospital ones that I showed you are the ones that we've said aren't dependent on testing. They are, whether people get tested or not. If those people get ill enough to go to the hospital or require ICU beds or something, those numbers will reflect what's going on in our community. How many people are adhering to it? So for whatever, we've got enough that we've been able to see those declines, and we've assessed it and feel we can go from red to orange. Now, if people start ignoring it, then we may start seeing these numbers go back up, and that's what's going to be the problem, and that's why we hope people will still continue to do this, and it benefits all of us.
Dr. Wong, you have this Public Health Committee and a Public Schools Committee getting information from you about this risk level. But this change and the variable you see within Dallas County of different school districts doing different things, what's the message to these families in Dallas County about sending their kids back to school now that you have created this new orange level? You've gone back to orange now. Does that mean, and I think Mr. Jenkins outlined different grade categories, but generally speaking, can I send my kid back to school now?
So the question was, now that we've gone from red to orange, and what's the message then for school? We've got the school health committee, and what's the message to those? I mean, what we're saying, I think, is that people still need to be cautious. There are a lot of sort of recommendations and plans that are now in place because of where we are. We're not saying for people to change those plans. And we are also saying that everyone should be very cautious as we sort of interpret these. And so, again, in no way are we saying we've moved from red to orange, open it all up, everything goes back to normal. So in the context, in that context, we hope that all the schools continue to evaluate that in that same spirit, because it is precarious. The data are dependent on everyone continuing to do what we're currently doing, but that does allow some things to open up to be.
I just want clarity on it, and I think I heard Mr. Jenkins say it correctly. In Dallas County Schools, grades 3 through 5 could essentially be welcomed back to those campuses. Do I have that correct? No. Come on in, please.
So what we said, I should have brought the notes up so I get it precisely, sorry. What the doctor said is, the question is, what grades are the doctors recommending come back to school? And the doctors are recommending that it is safe for pre-K through second grade to be welcomed back. So our youngest scholars, if space allows in the schools, then that school could welcome back 3 through 5. But they want a lot of spacing as they bring this first group of youngsters back and test like crazy around that to see how that's working. What they are recommending or strongly discouraging is any of our students grades 6 through 12. And so if you're a mom and dad and you're trying to figure that out and your school is open to all who want education and you want to follow the doctor's guidelines, you could feel comfortable sending back your up to second grade students and then making sure they have a lot of distance, your 3 through 5s, and if you follow the doctor guideline, as I will do, you'll do virtual learning for your over 6th grade students until such time as we can move to yellow. All of these things that we're talking about is how we get to yellow, right? If you want to see more businesses open, more kids back in school, and less people sick, then you follow these guidelines. You don't, you go to DallasCountyCovid.org, get them and follow them. Don't just say, well, we've moved to orange, and so I was thinking about having a big party, and now I think I will, because it's not okay to have a big party just because we've moved to orange. If we screw this up, it will take us probably until March to get it, have a chance to get it right again, because you guys will, the public will get together at Thanksgiving and Christmas with extended family, and if we have a high community spread when you're together for those holidays, then it'll take us 3 months after then to get right again. So we've got to not lose our resolve and not be selfish this weekend. We got to get the school stuff right, and then we got to keep wearing our mask, and we're going to be able to move to, instead of having to move back to red, we're going to get down to yellow and green together.
Have y'all had any conversations with the governor? I know he tweeted out earlier this week that he was looking at making an announcement next week about some changes in policy. Any conversations with the state about that?
Not about what he is planning to do. I'm not privy to what he is planning to do. We have encouraged that bars not be opened up right now in states. I'm sorry, I didn't repeat the question. The question was if we had conversations with the governor about what he's planning to do next week. I'm not privy to what he is planning to do next week. We have encouraged not to open bars. In states that have opened bars, that's been the problem. In fact, when you look, I was talking to some people that are in leadership at UNC, at the University of North Carolina at Chapel Hill, and they felt like they had a pretty good plan. By the way, they have a robust epidemiology program there, and that they followed their plan. The problem is the bars were open, and when the kids got back, or the young people got back, the scholars got back to school, they all went to the bars, or not all, but many went to the bars, many got together. COVID spread quickly, it got into the dorms, it led to the situation that they're in now. So we don't need those bars open, and we sure don't need to move to where some of these states have moved with permissive masking, because my mask protects you, and your mask protects me, and so for those people who won't wear a mask, they're saying, thanks for protecting me, but I don't really care about you. And there's enough of those people, if we were to relax our masking rules, that we would end up seeing more and more businesses fail, the economy hurt, people losing their jobs, more and more people getting sick and dying. I don't want to make this a personal thing, but I thought of this the other day, and it kind of sticks in my mind. When I was in college, I was having trouble keeping my grades up, and my father had died when I was 7 years old. My mom remarried a man who had served in World War II. And I was explaining to him how unfair it was and how with the heavy load that I had, I wasn't going to be able to keep my grades up. And he reminded me, he said, son, when I was your age, I was in England preparing to invade Europe. And so I think you can keep your grades up. So when we think of all of the things that our forefathers have done for us, that our parents, our grandparents have done, struggling to give us a better life, wearing a mask is a pretty small price to pay to keep our businesses open, our people healthy, and get our kids back into school. Thank y'all. Is that it? Thanks, guys.
Thank you, Judge.
Thank you. Did I get everything?